Hello and welcome to the final ERJ podcast of 2025. It's been a fantastic year for the journal. I'm joined by Don Sin, my colleague and deputy chief editor of the journal, to do our roundup of the ERJ in this year. We're going to go through our favorite papers. We're going to hand out some awards that probably don't count for very much, but they make us happy. And we're going to look forward to 2026 and exciting things ahead for the ERJ. So welcome, Don.
Hi.
I'm going to start by asking you for your top highlights of the ERJ this year. What have been the best papers? What have been the things you've enjoyed the most?
I don't know if they're the best papers, but certainly I think papers that make clinical management difference. And I've selected two from the severe asthma field, which I thought were very transformative. One was the Destination Navigator paper, first author, Michael Wexler. And it's entitled Clinical Response and On-Treatment Clinical Remission with Tezepelumab in Severe Asthma. And what this study showed was that tezepelumab, which is a biologic that targets TSLP, an important upstream cytokine for type 2 airway inflammation, the use of it over a 2-year period led to almost 50% remission in clinical asthma. So these patients who were struggling with their asthma with multiple exacerbations, high symptom load, high burden of disease, once they got on tezepelumab over a 2-year span, many of them didn't even require inhalers to the extent that they had used previously, and many of them were free of oral corticosteroids or even hospitalization and emergency visits. So I think this validates the notion that a long-term use of biologics, particularly biologics that target type 2 airway inflammation, significantly not only reduces airway inflammation, but improves clinical outcomes to the point where patients are almost quote-unquote normal on a day-to-day basis.
Yeah, and this has been a consistent theme in the journal. We've published half a dozen papers now on this concept of remission. I think there's still a healthy debate going on about how exactly you define that, but there's no question these patients are doing exceptionally well on these biologics.
I was just going to say that in November of this year, we had a similar paper, but focusing most on anti-IL-5 biologics. So this notion that biologics sustain or provide clinical remission is not restricted to anti-TSLP, but it's more broadly across the anti-type 2 cytokines, including anti-IL-5. And that was published by Hackinson et al. From Denmark. It's an extensive registry-based study, and it's now on ERJ website. Our third paper that I'd like to introduce is a question that I often get asked at clinical talks. Okay, my patients are on biologics for 1, 2, 3 years. Is there any way we can take them off of the biologics if my patients are doing extremely well? And that question was answered by the Optimal study, and it's entitled Titration of Anti-IL-5 Biologics in Severe Asthma, an Open Label Randomized Control Trial. And this was a very clever study from Søndergaard et al. From Denmark, where they took patients with severe asthma who had been on biologics for at least 1 year and achieved clinical remission. And then they asked the question, can we down titrate them off of biologics over 1 year? And what they found was by just prolonging the interval during which biologics were given over a 1-year period, they could get more than 50% of those patients off of biologics safely without incurring an exacerbation or significant flare-up in their symptoms. So this study, although a bit of a small study, shows that you can take patients off of biologics if they're doing extremely well on biologics for at least a year. And probably the mechanism to do it is to prolong the interval for each of the doses of biologics rather than decreasing the dose of the biologic. And so that paper was published in the ERJ and should be read for interested clinicians who are taking care of patients with severe asthma who are also on biologics and doing extremely well.
Yeah, it'd be Interesting to see if that's something that'll now start to feed through into clinical practice or whether larger studies are going to be needed. But these are relatively expensive drugs. And so good to see that there is some attempt to look at how we rationalize that. So good airways papers in the ERJ this year, which is great to hear. I'll jump in with a few statistics. So I love download stats and I love citations, Don. So we've got a league table of the most downloaded papers from this year, which I think probably won't surprise you that guidelines and statements kind of dominate. But the top downloaded paper for this year was the new update of the International Multidisciplinary Classification of Interstitial Pneumonias, an ERS ATS statement. And I'm going to give this one a special award. So it gets an award for the most downloaded paper and the most read paper in the journal. It also probably gets the award for the most controversial paper in the ERJ for a long time. So I think we must have got at least a dozen letters to the editor in response to this one, Don. So this is an update of the 2013 classification of interstitial lung diseases, and it introduces a number of new classifications of ILD. It refines the definitions of ILD. And one particular area of controversy was a new concept, or the wider use of a concept called bronchiolocentric interstitial pneumonia, BIP, which is a kind of overarching term for a number of conditions, including hypersensitivity pneumonitis, connective tissue disease associated change, aspiration, and a few others. That's generated a bit of controversy because of the relationship with hypersensitive pneumonitis and some letters suggesting sticking to HP may have been a better way forward. But in general, I would say that the response has been incredibly supportive of the changes. A lot of letters to the editor are also very supportive of the changes in terms of better describing what people are seeing in ILD. So we love letters to the editor. We love a bit of controversy. Journals exist to generate scientific discussion, and that one gets the award for generating the most debate, I think, in the journal so far.
Very good. If I can just jump in for a minute, Chris Ryerson is the first author, and I remember having a chat with Chris 15 years ago. He's a Vancouverite, just as I am.
Yeah.
And he was finishing up his residency, a fellowship, and we said, we don't know very much about this disease, but I think you're the right person, the smart person, to go and figure out what it is. And it turned out to be interstitial lung diseases and IPF in general. So it shows you how remarkable the progress has been in the knowledge and clinical management of ILDs in general since that time, over the last 10, 20 years. So congratulations to that area and to the scientists and clinicians who have been working tirelessly to improve the lives and health of millions of patients suffering from interstitial lung disease. And I'm sure the next update will be even better.
Absolutely. And it's a consistent feature every year that some of the top cited and read papers are in the ILD. So it tells you what a vibrant research field that is. Because the second top read paper in the journal this year was the ERS EULAR Clinical Practice Guideline on CTD-associated ILD. So again, the journal is dominated by highly read, highly cited papers in ILD this year. So indeed, an ERJ award to the ILD community for keeping us in a job and educating their fellow scientists. So an interesting one, the most read original research paper is also in asthma, which was dupilumab and lymphoma risk amongst patients with asthma, a population-based cohort study. I'm sort of not surprised that that was heavily read, because that clearly people are going to be interested in potential safety concerns. The thing I would say, this is a study that shows a weak association between dupilumab and future lymphoma, but also interestingly, a much lower mortality in asthma patients using dupilumab overall. Is always to be cautious with observational studies of the potential confounders. It nevertheless raises an important issue, and it's clear our readers have considered that that's an important issue. The other one I quickly wanted to highlight is second on the list in most downloaded, most read original research papers, which I think is well worth commenting on, is a long-term follow-up study of sotatercept for the treatment of pulmonary arterial hypertension. And the reason I highlight that is two reasons. Firstly, it's striking that that's a relatively rare pulmonary disease, pulmonary arterial hypertension, that these papers are being heavily read, which tells you that that therapy, the new activin signaling molecules, are of huge interest to people. But also, I'm very proud that the ERJ's published quite a large number of the papers in relation to sotatercept, which has now been approved by regulatory authorities for PH. So it's always nice for us to see a story moving through from preclinical to early phase studies and now to a drug reaching clinical practice. So a bit like what you were saying with the ILD field, Don, you have to give huge credit to the PH community who've really changed the game for what is still a devastating disease, but was a devastating disease with no treatments when I started working in respiratory medicine.
Yeah, absolute kudos to the PH scientists, patients, and clinicians. During my training in late 80s, early 90s, the treatment for pulmonary hypertension was a calcium channel blocker, if you can believe that. And that led to the lowering of not necessarily pulmonary blood pressure, but systemic blood pressure. And it gave terrible side effects to many patients. And this is, I think, a way to highlight the fact that exceptional care comes from exceptional science. And PH really highlights that notion.
Yeah, it's a path we would like a lot of respiratory diseases to follow in terms of how brilliant the therapeutic development has been in PH. Any other things you'd like to highlight, Don? And then I'll ask you to look forward to what we want from authors in 2026.
Well, as you've mentioned, we've had excellent ILD papers, PH papers, severe asthma papers, and so on. And ERJ, I think, is the go-to place for translational and clinical sciences in respiratory medicine. And we've had really a banner year in terms of the quality and the quantity of excellent papers, both original and review papers that have been submitted and published in the ERJ. And our turnaround time is extremely fast, probably in the top 3-4 percentile in respiratory sciences. So we welcome more submissions of high quality, and we look forward to seeing those papers being published in ERJ 2026.
Yeah, so important you highlight the speed there. We pride ourselves on speed.
And quality.
Most manuscripts are being handled, if they're sent out for peer review, in less than 40 days, which is, we think, amongst, if not the fastest in terms of turnaround time in the respiratory field. So definitely, we want all of your best manuscripts submitted to the ERJ. I'll make a particular call for randomized clinical trials, and we'd love to see more RCTs in the ERJ next year. Again, I love my stats, and I've been looking at the stats for citations in 2025, Don, and the two most highly cited, bearing in mind it's only 1 year of citations, but the two most highly cited papers are a phase 2A trial of the IL-33 monoclonal antibody tozorakimab in COPD, which is a phase 2 RCT, and DPP1 inhibition in adults with bronchiectasis, the early phase 2 randomized study. So people are very interested in phase 2 studies. And if you want to publish your phase 2 study in the ERJ, it shows you they get read and cited. So we'd love to see more RCTs in the ERJ next year, because we're all about trying to publish what you, the listeners, the readers, want to read and want to cite. So loads to look forward to in 2026, loads more exciting science. I feel like respiratory medicine is going through a very purple patch in terms of really good clinical studies, lots of exciting translational science. Respiratory is finally getting some of the attention it deserves. You felt the energy at ERS Congress this year, that there was a huge amount of new science being announced. So I'm very excited about what we're going to see in 2026, Don.
Absolutely. Can't wait. The key message here is that publishing is collaborative. It's between the authors and the editors and the reviewers. And ERJ is where those things happen on a regular basis.
So my best wishes for 2026. Happy holidays to all of our readers, our listeners, everybody who's part of the ERJ family. My thanks to Don for your exceptional work at the journal. Please do submit your best papers to us. If you've published with us in 2025, thank you so much. If we declined your paper in 2025, I'm so sorry. It is very competitive. Please do try again in 2026 and work with us, as Don says. But most importantly, keep on supporting the journal and being part of this family as we go into a new year. Thank you all very much, and see you for the January 2026 podcast, when we'll be highlighting a new original paper that's been published in the new year. Thank you and happy holidays.
Bye-bye.